My name is Paul O'Byrne. I have the great privilege of being the Dean of the Groot School of Medicine and Vice President for the Faculty of Health Sciences here at McMaster University. Welcome to you all, to the university and to our Health Science Center. I'm really delighted that you've taken the time to join us this afternoon for our 23rd annual ceremony to induct new members into the faculty's community of distinction. I would like to begin our procedures this afternoon by acknowledging and recognizing that we are here together in this wonderful space here in Hamilton on the traditional territories of the Mississauga and the Haudenosaunee nations, which is in the lands protected by the Dish with One Spoon Wampum Agreement. And we're here to celebrate three of our colleagues, Drs. Morris Blajchman, Basanti Majumdar, and Harry Shannon. And I'm very happy to welcome their families, their friends, colleagues who have joined us today to help us celebrate with these remarkable people. This community of distinction is placed in this prominent and very public location for a particular reason. It is inspiring to have those who help build the faculty's global reputation recognized here, right in the lobby of the Ewart Angus Center. This is a very high traffic location, and these pictures and the brief histories are seen daily by many thousands of individuals, faculty, staff, and students who are currently advancing our mission now and into the future. The recognition we're celebrating today was established to honor faculty, alumni, and staff who have brought distinction and profile through outstanding research and innovative scholarship to the Faculty of Health Sciences, as well as to McMaster University. And we do have quite a profile. For medicine and health sciences, McMaster is consistently, and has been for many years, ranked by all four of the world's universities' ranking systems as one of the top 50 universities in the world. These rankings are a testament to the faculty's world-renowned research and extraordinary educational innovations. Continuing this history of excellence, this year, in 2024, we have 4 new fellows elected to the Canadian Academy of Health Sciences, as well as 6 of our faculty members recognized by the Royal Society of Canada, which is Canada's highest recognition for academic excellence. It is our responsibility to recognize, to acknowledge, and to honor those exceptional individuals who are able to change history for the better. And that's our mission. That's why we're here today. The 3 people we are celebrating have spent more than 120 years here at McMaster University. I'm not sure they want me to share that information with you, but there it is. Each of them has spent a really important component of their career at McMaster with impact felt deeply at our university, across Ontario, Canada, as well as around the world. The newest inductees include Dr. Morris, known to everybody as Mo Blajchman, one of the founding members of the School of Medicine at McMaster University. Sadly, Dr. Blajchman passed away in 2022 at the age of 82. He was an extraordinary clinical scientist, publishing well over 300 peer-reviewed publications and teaching generations of medical students and residents. His pioneering research in transfusion medicine helped cement McMaster's reputation, which it has very strongly still today, as a global center of excellence in hematology, as well as improving the lives of countless patients. In addition, we are inducting Basanti Majumdar, who is internationally renowned for her research and teaching about HIV/AIDS, women's empowerment, problem-based learning, and self-directed learning methods. Basanti's passion for enhancing the lives of marginalized communities and the socioeconomic determinants of healthcare traces back to her early years in India and was solidified during her time at Columbia University. As a professor in the Faculty of Nursing at McMaster, she organized international conferences in India, in Thailand, in South Africa, Bangladesh, enabling local researchers to present their work and to connect globally. Our third inductee, Dr. Harry Shannon, is a world leader in occupational health and safety. Harry's work significantly impacted work health and safety, humanitarian programs, as well as global health. Among his extraordinary accomplishments, he was the lead author of a widely cited, groundbreaking paper that provided essential guidance on evaluating occupational safety interventions. This work was later expanded into a book published in 2001 by the US National Institutes for Occupational Health and Safety. All three of our Community of Distinction inductees today have had a deep passion for advancing knowledge to improve the health of all of us, which has had a remarkable impact on McMaster's international leadership in health professional education, as well as our world standing in evidence-based medicine and health research methodologies. And I know that all of us are deeply grateful for their many meaningful contributions. So I would like to formally begin our activities this afternoon by introducing Dr. William Sheffield, who will induct our first new member of the Community of Distinction, Dr. Morris Blajchman. Dr. Sheffield is professor in McMaster's Department of Pathology and Molecular Medicine. Dr. Sheffield.
Well, thank you, Dr. O'Byrne. And it's an honor and a privilege to say a few words about Mo, Dr. Morris Blajchman, known as Mo to his legions of friends and colleagues. When I met Mo, my postdoctoral mentor in 1989, when I arrived in this building, he was already approaching the middle of an amazing career. And he had been here for over 15 years, as Dr. O'Byrne said, contributing to the founding of this medical school. And he'd already been active with all kinds of learners. And this was a natural outcome of Mo's deep and abiding love of learning. And he was just fascinated and highly respectful for the generation of knowledge. And it didn't matter whether the learner was an undergraduate, a medical lab technologist, a medical resident, a surgical colleague, or a basic research colleague. Mo's interactions were always warm and always deep and abiding in their generation of knowledge. And as I speak to you, it's not lost upon me that if I had A, the strength, and B, the length of a yardstick, it'd be about 50 meters long, and if there wasn't that pesky wall in the way, I could reach out and touch the office that Mo occupied for much of his tenure in this building and at this university. And that was a place of exchange of knowledge, of vigorous debate, but it was also a place of warmth and occasionally of laughter. Laughter that when it came to Mo would shake his entire body and was just an element of his personality and the warmth and knowledge that he shared. So I could go on and on at length about his contributions. By my count, it's over 400 peer-reviewed publications, but over 300 and over 400, they are both true statements. And he led clinical trials. He led basic research in animal models related to his area of focus in blood disorders and blood transfusion. But as I say, it wasn't only what he did, but how he did it, which is a mark of his greatness and his contributions to this faculty and to this university. So rather than going on at length, and I would be happy to share many anecdotes of happy memories of Mo and his contributions later, I will do what I was asked to do, which is to read the citation which inducts him into this esteemed community of distinction. So Morris Mo Blajchman, a hematologist, was a professor emeritus of medicine and pathology and molecular medicine at McMaster University. One of the founding members of the School of Medicine at McMaster, his extensive research included studies of new platelet products and substitutes, blood transfusions, the significance of bacteria in the blood, and alternatives to transfusions in critical care patients. Dr. Blajchman served as the chair of the Transfusion Medicine and Hemostasis Clinical Trials Network of the National Heart, Lung, and Blood Institute in the United States. Regarded as a true clinician scientist, Dr. Blajchman has held leadership roles in the transfusion medicine research programs at McMaster. He taught generations of medical students and residents and was regarded as an indelible role model, inspiring future generations of transfusion medicine leaders.
Thank you very much, William. Very thoughtful comments. I would now like to introduce Katie Ribot, who will induct the second new member of the Community of Distinction, Dr. Basanti Majumdar. Katie.
Thank you. Hello, everyone. My name is Katie Ribot, and I have the distinct honor of introducing Dr. Basanti Majumdar. Now, you may be wondering who I am. I am not a nurse. I am not a doctor. In fact, I get a little queasy with blood, and I get lightheaded with needles, so that was never in the cards for me. But I had the privilege of meeting Dr. Majumdar through her philanthropy. I work in university advancement here at McMaster, and she is one of the extraordinary donors I get to work with from day to day. Before I get into her citation, full of her incredible professional accomplishments, I wanted to share with you a recent note she received from a former student, which I am reading with her permission. I was a nursing student in the class of 1984. You pulled me aside one day and asked if I had ever thought of a career in medicine. I was so relieved because this was my dream. I recall you wrote me a letter of reference. I got into medical school and am enjoying a lovely career in family and sport medicine. While I am sure you won't remember me from the thousands of nursing students that you influenced over your career, I wanted to take the moment to say thank you for your confidence in me and for encouraging me to follow my heart. This message comes from Dr. Margot Mountjoy, a McMaster alumna and McMaster's current dean of our Waterloo Regional Campus in the School of Medicine. Dr. Mountjoy also partners with international organizations to support underprivileged athletes, especially women, and those facing mental health challenges from abuse in sports. As Dr. Mountjoy noted, Dr. Majumdar has likely influenced countless students who are making a difference worldwide. Now for the official citation. Dr. Basanti Majumdar is internationally renowned for her research and teaching on HIV/AIDS, women's empowerment, problem-based, and self-directed learning methods. She earned her bachelor's and master's of nursing degrees from Delhi University and later obtained an additional master's at McMaster and a PhD in adult education from Michigan State University. Her passion for enhancing the lives of marginalized communities and the socioeconomic determinants of healthcare traces back to her early years in India and was solidified during her time at Columbia University. As a professor in the Faculty of Nursing at McMaster University, she organized international conferences in India, Thailand, South Africa, and Bangladesh, enabling local researchers to present their work and connect globally. Through these efforts, she strengthened ties between McMaster and ethnocultural communities, advancing research and education in developing countries. As you can see, Dr. Majumdar has been a trailblazer in so many ways, but the ripple effect of her kindness, mentorship, and belief in her students, like Dr. Margot Mountjoy, is perhaps her greatest legacy. It is my honor to celebrate Dr. Majumdar and welcome her to the stage.
Don't forget my third leg. I call it third leg, my cane.
Is there a way to get this a little? I got it, never mind.
Okay. I have 5 minutes. So if I'm out of 5 minutes, do the McMaster way. That is. Dear Dr. Aubin, Dean and Vice President, thank you. I am honored to receive this award. My thanks goes to nomination committee and the selection committee and all of you who are here. I would take few minutes, remember, few minutes, to thank those who were and are at the backstage of my life, because I believe very strongly, and I am going to give some names you may not know, but they are right here in my heart, and if you look at the ceiling, you will see them. They are in the stars. My ma, I call ma, not mom, so I will say ma, and my baba, that is my father. My ma and baba gave me values of life and self-confidence. My brothers and sisters constantly encouraged me to continue my studies. Though they were in India, but they kept going. My husband, Sujit Majumdar, took responsibilities of our family when I was traveling. Our both sons, Sujoy and Sumit, and their wives, who are here also, Shampa and Lindsay, and my grandchildren, Asha and Ajay. They're part and parcel of my long journey. In 1971, I want you to go back a little bit. In 1971, Dr. Dorothy Kurgan, who was Dean of School of Nursing, asked me to join Faculty of Health Sciences. I was interviewed by Dr. John Evans. I don't know how many of you know, but he was very dear to me. And School of Nursing definitely is dear to him. Dr. Mustard and Dr. Sibley, these are the people who interviewed me. So none of them are here, but they were part and parcel of my life. And I remember Dr. Evans asked me, why should we hire you? And then he said, what would be your contribution to Faculty of Health Sciences? Based on my experience from New York, I learned to care for heterogeneous population. And while I was there, I got to know people from Harlem, which is because McMaster, not school, no, I think it's the Columbia University, which is very close to Harlem. So I had a lot of friends from Harlem. And I also met the boys who came back from Vietnam. So Vietnam War, and I was part of them because I took care of some of them. So it was a very heterogeneous. But when I came here in Hamilton in 1971, the population was homogeneous, mostly. Do you remember, any one of you? Well, if you don't, I'm telling and you have to accept. And so I told him that preparing healthcare providers to give quality of care to multicultural immigrant population will be my task. At that time, I met Dr. Dave Davis. Do you remember him? He was the chair of the family medicine. He said, that's a good idea. So, if anybody tells me good idea, I clutch them. So I went to him, how about we do a conference, one-day conference on multicultural health? And he said, that's not bad. So we did it. And doctors and nurses, social workers, physiotherapists, all joined. Believe me or not, one-day workshop, and we had more than 100 people. So that gives you an idea that it was a needed one. But then what happened, roundabout in the evening, I get a call. The keynote speaker said he cannot come. So what do? I ran to Dr. Fraser Mustard. At that time, he was doing hypertension and looking at the population. So I said, how about you become the speaker? He said, me? Multicultural? I said, yeah. Look at your population. And he became the first speaker of multicultural health. See, a lot of history. Now I'd like to tell about, I met Dr. Vic Newfield and Dr. Stuart McLeod. And they said, just don't think of international health, think of global health. That's a good idea. So, but we don't have any courses on it. So here I go. I went to Dr. Peter George. He was at that time the head honcho of the university. So he says, oh, okay, I will do it. Then I said, but we need all these things, approval for this place and that place. He said, I will take care of it. Thank God, because I always break the rules. So he kind of went through with me, and we got it. So our new course started. It was international health. Then a lot of people helped us, and one of them I remember is Professor Barbara Carpio. She was really, really good to get together as a team. And then I met Stuart McLeod, Dr. Stuart McLeod. He was at that time the chair of the health sciences. And also I met Vic Newfield. He was the head of international. And they said, international health is not the right word. You have to think of global health. I said, okay, as long as we can change it to global health. So we changed to global health. And that was not enough. Then they said, how are you going to go to all over the world and tell them that McMaster is doing this international work? So we had international conferences. And these international conferences were in Thailand, in Vietnam, you can name it, 76 countries we moved around, and we started this international conference. But what you must be thinking, why did we do international conference in the developing country? Anybody has an answer? If not, I will give you the answer. See, lot of researchers and educators are in the developing country, and they can't come to the developed country because of travel, because of the registration fee. So we don't know what they are doing. How about we go there? And that's how we started. That is, we went there, not just the faculty, but the students, and we shared our researches, and we dialogued with them, and our students and faculty found we think the same thing. We are all having the same issues and problems, and the commonality of our facing the human rights thing. I will go then to the last part, and that is having faculty and good friends is a very important thing in our life. I can think of a friend is Professor Jerry Benson. She was always with me. wherever I went, though that was not her specialty, the beauty of it is that she supported me. And then comes the students, Tracy Chambers, Jan Mitten, Rihanna, and Ruth. They were my backbones to walk straight. See, they are now not here, and I have a third leg. Now, at the end, success of outcome depends on dedicated faculty, students, and friends. Without them, you cannot proceed. So what I'm trying to say, that with that I want to add two more people, and that is our local community and the youth of the society. So thank you very much. Again, my Majumdar family, Faculty of Health Sciences team, the students, friends, community members. Without you, I couldn't have got this award. Thank you.
Step down off the stage.
Yes. Step down?
No, this way.
Okay.
Just turn this way. There we go.
Okay.
You look so lovely. We have to photograph this.
Thank you. Thank you.
Make sure.
You are the doctor. You should take care of me.
So I would now like to introduce Dr. Lahana Tabane to induct Dr. Harry Shannon to the Community of Distinction. Dr. Tabane, as you all very well know, is professor in our Department of Health Research Methods, Evidence, and Impact, as well as vice president for research at St. Joseph's Healthcare. Lahana.
Well, it's such a delight. I never had the opportunity to work with Mo, but I've had the opportunity and the privilege of working with Basu. I used to call her Basu, and Harry. And congratulations, Basu. And I also want to congratulate Mo's family for this recognition. You know, we all wish he was here to celebrate with us. And congratulations, Basu, and your family as well. It's such a delight to see you. You know, I always remember that smile very fondly. But I always, you know, I think I've been coming to this event probably for the third time now, if not fourth time. And I always want to acknowledge our dean. You know, we're incredibly lucky. We don't realize how lucky we are. We have a leader who is really dedicated to caring about others. You know, it's amazing, you know, how he really dedicates to showing kindness to everybody. We know kindness doesn't only benefit the people who receive it, but it also benefits those who give it. But we also know there's evidence showing that actually people who bear witness to kindness benefit. So we should always thank Paul for always taking the time to care about us. I know leadership is a lonely role, but we hope you feel encouraged that we see your kindness to other people, and we're grateful for that. Right. All right, now my task is to say a few words about Harry. Well, you know, it's amazing. I was actually recruited to this university by Dr. Brian Hayes. He was the chair of the department at the time. And I remember coming in, and one day I met Harry Shannon. It was my first few days, and I said, gosh, if everybody in this department is as kind as Harry, I'm going to stay here forever. And I'm still here. So it is nothing short of privilege to stand here before you this evening as we recognize and celebrate these three individuals whose remarkable contributions have brought global renown to not only McMaster, but the Faculty of Health Sciences. And among them is Harry Shannon, whose profound impact in the realm of scholarship, public health, and leadership truly exemplifies the spirit of the Committee of Distinction. So this award, the Committee of Distinction, is the Faculty of Health Sciences' highest accolade, reserved only for those whose exceptional achievements in scholarship, science, and delivery of care, or perhaps leadership, have earned the admiration and respect of their peers. Dr. Shannon's induction this evening is a testament to his commitment to improving the lives of others through rigorous research, compassionate leadership, and unrelenting pursuit of excellence. Dr. Shannon's academic journey is one that is marked by distinction. He began his studies at the University of Oxford, an MBA in mathematics, followed by a master's in mathematical statistics from Birmingham University in England. And then he completed his PhD in applied statistics from the University of London, also in England. This academic milestone reflects a foundation built on intellectual curiosity, dedication, and mastery of his craft, qualities that have defined his career from the very beginning. In 1977, McMaster University gained an invaluable asset when Dr. Shannon joined the Department of Clinical Epidemiology and Biostatistics. That's how it was called at the time. Today we call it Health Research Methods, Evidence, and Impact. Over the years, he has played a central role in shaping that department, driving forward the mission of rigorous inquiry and impactful research. His legacy continues today as Professor Emeritus, where his influence extends not only through his academic contributions, but also through the many students and colleagues he's mentored along the way. Dr. Shannon's contributions to occupational health have been transformative in many ways. His pioneering research on the relationship between organizational factors and workplace injury rates has redefined the way we approach work safety or workplace safety. His seminal paper that Paul referred to earlier on was published in Safety Science, and it established the methodological standards that have become the gold standards for occupational safety intervention research worldwide. This work has informed policies, reshaped regulatory frameworks, and most importantly, improved the lives and safety of workers across all various industries. But beyond the technical brilliance of his research lies something even more profound. Dr. Shannon's steadfast commitment to improving the human condition. His work is not driven by the accolades or recognition, but by a genuine desire to make the world a much safer and a much fairer place for all. His transition to focusing on vulnerable populations in regions like the occupied Palestinian territories, Lebanon, and Haiti underscores his deep humanitarian spirit. For example, he worked with scholars in Basanti University on the West Bank to establish research training programs, empowering communities to address their own health and social challenges. Dr. Shannon's capacity to blend rigorous academic inquiry with deep sense of empathy is truly extraordinary. At the heart of his work is a belief that research should not only expand knowledge, but also create meaningful change. His contributions to global health, particularly in some of the most challenging and politically complex regions of the world, speak to his courage, his resilience, and moral conviction. As an educator and mentor, Dr. Shannon's impact has been nothing short of transformative. He has guided nearly 100 graduate students, fostering their growth and inspiring them to carry forward the values of intellectual curiosity and social responsibility that has defined his own career. His innovative approach to teaching statistics, and lots of people don't like statistics, grounded in real-world problem solving, has equipped countless students with the tools to apply their knowledge in ways that drive positive change. His influence on these students will be felt for generations to come. Dr. Shannon's scholarly contributions are vast, with over 160 peer-reviewed publications spanning many areas that include occupational health, cancer epidemiology, injury prevention, and statistical methodology. His work has garnered significant recognition, including prestigious awards such as the International Society of Biomechanics Clinical Biomechanics Award and the Jensen Author Inc. English Literary Award. These accolades speak to the high regard in which his work is held both nationally and internationally. As we celebrate him this evening, we acknowledge that not only his outstanding academic achievements, but also the profound ways in which he's used his expertise to effect change in the world. His work embodies the very essence of what it means to be a member of the community of distinction, a leader whose contribution transcends disciplines, boundaries, and perhaps expectations. Harry, it is with admiration and respect that we honor you this evening. Your contributions to McMaster University and the Faculty of Health Sciences and to the field of health research, to the society at large, have left an indelible mark. Your legacy will continue to inspire generations to come. Congratulations on your well-deserved recognition, and thank you for all that you have done to make this place a much better and safer place and a much more just place for everybody. Thank you. I will welcome Dr. Harry Shannon to the stage to say a few words.
Thank you, Dr. Tabani Lahana, for your generous remarks. In considering what to say today, I thought about the many people over the years who I'm grateful to for their wisdom and advice. I only have time to mention a few and what they taught me. Richard Schilling hired me for my first academic job at the London School of Hygiene and Tropical Medicine in occupational health. He emphasized the importance of knowing thoroughly the workplace where you do your research. He set a good example. He himself spent time on trawlers in the North Sea, understanding firsthand the hazards of commercial fishing. When I came for my interview to McMaster, there was already a relationship and an agreement to do research in the nickel industry. So in line with the idea of getting to know the workplace, I made a trip up to Sudbury in January. So I think I learned more about Canadian winters than I did about nickel mining and refining. David Muir directed the occupational health program. He stressed the need to work with joint health and safety committees, including both management and labor representatives. He also emphasized the importance of being scrupulously neutral in dealing with these parties. Doing research in occupational health, I learned a lot from workers about their jobs and work processes. At the same time, they typically had very little or no background in research. There's a character in Kurt Vonnegut's novel Cat's Cradle who says, any scientist who can't explain what he's doing to an 8-year-old is a charlatan. This reminded me not to use jargon when explaining my research. For a few years, I was seconded part-time to the Institute for Work and Health in Toronto. When some of our research results there were criticized by vested interests, Terry Sullivan, the president, reassured us. If you're being attacked, he said, it means you're making a difference. Leanna mentioned some of my work overseas. I developed an ongoing collaboration and friendship with some wonderful Palestinian researchers. In particular, Rita Jackman, who was director of the Institute of Community and Public Health at Birzeit University on the West Bank. I can only describe her as a force of nature. She introduced me to the concept of political determinants of health. She promoted the development of culturally relevant and appropriate measurement instruments. We studied the psychological impact of violence on children. As Rita puts it, abnormal behaviors may be a normal reaction to abnormal situations. One time I was picking up my son from his music lesson. His teacher, Lorraine Dargavel, told him, "The aim of every teacher is to make their students better than they, the teachers, are." It was almost a throwaway remark, but it has guided my teaching. I've had some wonderful students over the years. Some of them have made me think differently. Others have brought me unwarranted credit. And there are one or two in the audience who meet that definition. I have another reason to thank Richard Schilling. In exactly 40 days' time, it will be the 50th anniversary of the 16th of December, 1974. That Monday morning, following a soccer injury at the weekend, I struggled into work in central London. But I realized I needed medical attention. I went down the corridor, or hobbled down the corridor, to ask a colleague for a lift to emergency. When I went into his office, there was someone else there, Eileen. Richard Schilling had hired her, and it was her first day on the job. A couple of years later, we were married. I have learned so much from Eileen. Without her love, her support, and her counsel, I could not have achieved what I have done. I am so, so grateful. Finally, I'd like to thank Chantal Van Ray and Betty Chung from the Dean's Office, who are delightful to work with and have done so much work behind the scenes to make this a memorable occasion. Thank you. Thank you.
No, it's amazing because sometimes you have an assignment and you forget to do one of the most important part of the assignment, which is to read the citation. All right, the citation goes like, Harry Shannon is a professor emeritus at McMaster University. He studied at Oxford and obtained a PhD in applied statistics at the University of London. A world leader in methods and statistics, he has significantly impacted work health and safety, humanitarian programs, and global health. Dr. Shannon was the first author of a widely cited, groundbreaking paper that provided essential guidance on evaluating occupational health safety interventions. This work was later expanded into a book published in 2001 by the US National Institute of Occupational Safety and Health. He has established innovative sampling methodology in challenging settings, such as war zones and refugee camps, and his studies in Haiti, Lebanon, and Palestine have provided invaluable insights into public health, preventative medicine, epidemiology, and biostatistics. Thank you.
Thank you, Harry. Thank you, Lahana. Thank you, everybody, for joining for this wonderful celebration. One of the best parts of this event, I think, is that we get to hear about the extraordinary achievements of our colleagues, who, many of whom were here the earlier days of this medical school. And this is indeed the foundation upon which every other success we have had has been built. So we owe our three colleagues today and all of those who are recognized in the community of distinction a huge vote of thanks and congratulations. I want to thank William, Katie, Lahana for taking responsibility to introducing our new members, and also add my thanks to that of Harry, to Betty Chung, Stephanie Cusack, right over here, and Chantal Van Ray, who really put an immense amount of effort into ensuring this is a wonderful event, a celebratory afternoon. In fact, I think one of the real highlights of our academic year. So thank you all very much for doing that. Not only that, but we have refreshments, and they are at the back of the room. I hope many of you can stay to help us continue the celebration. And thank you all again for joining us at this wonderful event. Thank you.